Hi everybody, I hope you're all well out there. Today's session is about welcoming student nurses and trainee nursing associates to their placement. It's fundamental that there's a structured welcome for learners as it sets the tone for the whole placement. I used to be a lecturer practitioner and I organised student welcomes and a pre-placement meeting, and I'm going to share some tips that I used that managers or clinical nurse educators might find useful. Remember, if you find this session helpful, give me a thumbs up on YouTube, and if you've got any ideas or initiatives linked to your own areas that you've used for your own welcomes, do share them in the YouTube comments to support others. So why is the welcome and support of student nurses and trainee nursing associates so important? According to the Nuffield Trust, the average nursing student attrition rate in the UK is around 24%, and applications for undergraduate nursing courses fell last year. So on average, nearly a quarter of nursing students left their course early or suspended their studies, and there's a range of reasons why students leave, and poor placement experiences will be one of those reasons. I was really pleased to read the new Health Education England Workforce Strategy, came out in March 2023, and I encourage all clinical educators and managers to read that strategy. It acknowledges the importance of education and training to retain staff, and one of the key strategic priorities in that document is to establish and prioritise protected educator time, which will be able to, they'll be able to use time to welcome students and assure those high standards of preceptorship, clinical supervision, etc. for newly registered nurses and nursing associates. But all registered nurses should care about students and trainee nursing associate experiences as a profession when they're in placement. The future of nursing depends on retaining and recruiting staff, and the welcome and support that you offer in your clinical area or your field will give an overall impression of your workplace. It is not okay to ignore a student or trainee nursing associate who joins your team, or to gossip or be rude to students and unprofessional. Students are your future applicants. They are not going to apply to areas where there is ineffective team working and where staff are not friendly to them, or they observe any incivility or rudeness. A student's experience will lead them to apply for a job or not in an area. So we need to remember that a student nurse, like any person who has a bad experience, like a customer in a shop, for example, you're probably going to share that poor experience with another 15 to 20 other people on average. This is fantastic if a student or a trainee nursing associate's had a good placement experience, but if they feel unwelcome and unsupported, it's going to affect your future applications. So I hope that some of my tips today help increase awareness of the importance of welcomes and give you some ideas to support students and trainee nursing associates. And I thought I'd use a simple mnemonic, K.I.N.D, kind, to present these tips as it fitted basically with my tips. And we need to be kind to students and trainee nursing associates who are juggling assignments and placement hours. If you have any other ideas and strategies, do put them in the YouTube comments to support others as well. So let's start with the K in kind, which relates to the key things that you need to know about a student or a trainee nursing associate before they arrive to plan and welcome them. Firstly, what is their name? And it's important that you make an effort to get to know all learners' names in placements to make them feel part of the team. What date do they arrive and what year are they on their degree programme? Placement leads or placement facilitators should have the information, so make sure you talk to key placement leads if you feel communication between you could be improved. Also, what proficiencies does the student or trainee nursing associate need to complete? You can get these off university programme leads in advance. Again, ask for them if you're unsure. So you need to know exactly which first year, second year, third year or fourth year, if they're dual or part-time students, which proficiencies are expected to be signed off during this particular placement with you. You can also ask the student or trainee nursing associate on arrival to cross-reference them, but it's good to be pre-warned. who will be their practice supervisor, practice assessor and academic assessor. And you need to be really clear on who decides the allocation, especially for practice supervisors in your areas. And practice assessor, do you rotate the roles across team members? You might need to use spoke areas at certain times to help with the allocation. So if we had third year near to registering students who had been there a while, they could spend time with specialist nurses or advanced nurse practitioners, for example. But having somebody to map that and the experiences and to oversee how many students and when is important. What will their first 2 weeks of rota be? And I truly believe that all students should be entitled to have their rota in advance, pre-placement, before they arrive. All students deserve that. Some of them have got childcare or caring responsibilities. And how will I communicate their arrival to enable the rest of the team to know? So they don't just turn up on day one and nobody knowing their name or who they are. That's very important. So a few more tips under K, knowing about the student or trainee nursing associate. In my experience, it's best to have key lead or leads responsible for planning student nurse or trainee nursing associate arrivals and welcomes in a local area. It's good to have more than one person in case of sickness, and there needs to be someone responsible for the allocation of those practice supervisors and assessors who links to rotas. Might be the same person, might be a line manager, but you need to think about that structure of allocation. I know some employers have clinical educator roles, but I know many clinical settings don't. And it doesn't need to be a senior nurse necessarily to be responsible, but it needs to be clear who is responsible. And sometimes an experienced, motivated and enthusiastic staff nurse would be ideal to deliver the welcome meeting, so it can be delegated down. A senior manager might need to let go of some of that responsibility and delegate. They might find that hard, but it means that a staff nurse can then develop those transferable skills, and they may wish to become a nurse educator in the future, so it helps to develop their career as well. Communication is key. You need good communication between placement leads, the university, and whoever's allocating students in the placement area, so you know exactly when students are arriving and you have their details. Then once you know who's arriving, think about the best way to communicate with your team about those arrivals. If you've got short notice for some reason, do you need to put an email out or a notice up? You might want to use a student board. There's different ways of disseminating information. You might have a document store, for example, people using digital technology a lot more. When I was responsible for students as a lecturer practitioner, we had a communication board, and we would put out the student competencies then. They weren't proficiencies, a handbook on the board in a wallet. But as I said, nowadays you could use a document store and use information technology, which leads nicely on to the I in kind. So moving on to the I in kind, which I've put as information giving. You'll need to induct students to your placement area. That's another I, and it helps to provide a welcome meeting. And I found it helpful to offer that welcome meeting, an informal visit, for students to walk around the area before their arrival date during a pre-placement meeting. It was really efficient use of my time, as I'd organise the meeting and walk around with groups of students, or maybe 2 students, on a date where I would calendar in the meeting. I would be giving the same information about neurosciences, which was my speciality, for first, second, third year students. I'd be going over the shift times, saying the same thing, whatever year of student. So rather than them all arriving separately on their first date for their first shift and having to repeat the same information again and again on several occasions, I would try to coordinate this pre-placement meeting on a date that suited the largest number of students and myself. Students loved it, as they felt anxious, they felt less anxious seeing other students. They felt more confident to ask questions in a group, and I wasn't leaving a shift during that meeting because it was coordinated on a time that I could do. Anyone that couldn't come to that meeting, I would give another date, or I might send information on an email, a welcoming email instead, and attach a welcome pack. So if for whatever reason you couldn't organise a welcome meeting due to sickness, you can still do send pre-placement information and a nice email welcoming a student or a trainee nursing associate to the area and with their shift patterns. It's helpful to summarise key information about your placement area in a student welcome pack and a welcome board. For example, you might want a communication board. You should list key contacts, phone numbers, emails, shift times, what the student does if they're sick, what the expectations are for uniforms, for lockers. During the walk round and welcome meeting, I would go through this pack in groups with the students, and then I'd give them their rotas. I'd talk through learning opportunities. But as I said, this could be sent digitally now to save paper. But try to think creatively. Could a current final year student, for example, help write one of these packs for you or review one? Could you rejig a pack that you've got for newly registered nurses into a student welcome pack? Could specialist nurses or case coordinators or different allied health professionals write a section for you in your welcome pack? Could you have photos of staff with a few lines about their role, or you might do it digitally and have videos? So hopefully that covers I, and I will move on to N. Next is the N in kind, which is meeting the needs of learners wherever possible. First thing is try not to compare students. Each student's going to have different learning needs and previous placement experiences. And I remember being contacted by a mentor when we had practice supervisors, were called mentors then, who said that this particular student, it's a final year student, was really struggling, and their level of skills was like that of a first or second year. This was an acute care setting, and the student had only had one placement in the hospital before, and they had worked in a clinic or an endoscopy unit. It was a clinic type area. It was going to take them longer to get used to a busy acute hospital ward. Once the mentor realised this, she changed her approach. She was more patient and focused on teaching the fundamentals of acute care, and clinical educators offered some extra support. But the student was very person-centred in their approach, and the mentor realised that this student had higher levels of key transferable skills in different areas such as rehabilitation, communication. It was only from taking the time to get to know the student that this happened. That student is now a ward manager, but how different that situation could have been. So, does this learner have specific needs? What else is going on in their life? Do they have resits? Are they in the middle of a dissertation? Do they have children, carer responsibilities? Wherever possible, I would rejig rotas to suit students with children, or if they had caring responsibilities. And even if they had a hobby once a week, where possible, I would try and meet their individual needs. And I know that that is difficult to do sometimes, but I truly believe we should aim to be as flexible with students and trainee nursing associates as we are with staff on rotas wherever possible. This works both ways. Students need to be flexible too. They can't have a different start time, for example, and miss handover. Again, doing pre-placement meetings really help with that, because students would let me know and we could develop that relationship of trust and try to meet in the middle, which is really helpful for both the area and the student. So finally, we have D for developmental opportunities. What learning opportunities are there in your area, and what are we used to call them spoke areas. I don't know if you call them that, but for example, we had neurology and neurosurgical clinics that they could potentially attend, neuroradiology, investigative areas. We had EEG, electroencephalography, for example, or charities such as Headway, Motor Neurone Disease Association. You've also got key staff, so we had the clinical educators, allied health professionals, specialist nurses, advanced nurse practitioners, and key meetings that they might be able to attend, like safeguarding, case conferences, multidisciplinary, discharge. You might have clinical governance or incident reporting meetings, or any shadowing opportunities. And it's important to think about those before students and trainee nursing associates arrive, because if you've got a particularly busy shift and you know that the staffing might be a little bit lower on that day, it might be ideal for the student or for a trainee nursing associate for you to arrange for them to go off onto another area for a morning or for an afternoon. And then theatre as well was another area that we could link them to. And then we've got the learning resources and study days. So can they attend the same session as a newly registered nurse or on a research conference day, for example? They can reflect after. Many of our study days, training days are clinical based, so it will enhance their care, and they can reflect afterwards, relating it to patients that they've cared for or relating to core professional skills. And so we were really flexible with that. And finally, discussing career opportunities. So promoting jobs and keeping connected with interested students and trainee nursing associates is very important. So I hope you found some of this talk helpful. Remember to be kind to students and nursing associates. K, all the team should know about the student trainee nursing associate arriving, and preparation should be in place to support them before they arrive. Use a pre-placement week meeting and walk round to welcome them where possible. I, for information giving, should be clear, planned and coordinated. N, try to meet the needs of the person using a person-centred approach. And D, offer development and learning opportunities. I've had a lot more sort of information I could give you, but that's just like a summary really. Do give some information of your own welcomes. You might have some fantastic ideas, and do put them in the YouTube comments. If you have any questions at all or want to DM me, you can DM me on Twitter or my website. Do check out my other videos on my YouTube channel. They're all free to support nurses of all different levels and students. And if you are interested in buying either of my books, there is a link in the description on YouTube.